Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw, Cebu. I'm Priya Padilla-Roleda from CDN Digital together with the hospital at Maayo, and this is Maayong Adlaw Doc. In the last episode of Maayong Adlaw Doc Season 4, we discussed about the importance of dental hygiene or the importance of dental health and oral hygiene from our dentist guest, Dr. Kathy Tan. This time we have another interesting topic, and that is about our ears and our nose. But before we head over to our talk and introduce our guest today, let's watch this video first from the hospital at Maayo. Ears, nose, and throat, head and neck surgery unit. The hospital at Maayo's ear, nose, and throat, head and neck surgery unit is driven to provide the best healthcare management of the ear, nose, throat, head, and neck through state-of-the-art equipment, competent and well-trained personnel, and individually focused service of the patient's wellness. Here in one of Cebu's bustling cities, Mandaue, the hospital at Maayo is designed to give you the care and services you deserve. They prioritize your health, put your needs on top, and make sure to give you a holistic medical experience. For today's episode, we are going to talk about ear and nose infections and how to treat them. Let's learn more about this health problem from our guest doctor today. Our guest doctor for today is a consultant of the hospital at Maayo Ear, Nose, and Throat, Head and Neck Surgery Unit. He studied medicine at Cebu Doctors University and is a diplomate of the Philippine Board of Otolaryngology, Head, Nose, and Throat, as well as a fellow of the Philippine Society of Otolaryngology, Head, Nose, and Throat. Let us all welcome our guest doctor for today, Dr. Jimon Cabañesas. Good afternoon, Doc. How are you doing?
Hello, good afternoon. I'm good. Thank you. How about you?
I'm good, Doc. Thank you for asking. Well, Doc Jimon here is an ENT doctor, right?
Exactly.
Okay. And I'd like to know what are the more common problems you encounter in the clinic. Like, let's start, let's say, since ENT, that's ears, nose, throat. Let's just talk about the ears for now. Okay, what's the most common ear problem?
Yeah, majority of the patient who will go to our clinic, they have problems related to ear pain, hearing loss, ear discharge. Now, these three constitutes majority of the patients. I would say like more than 50%. They complain of ear pain, hearing loss, and ear discharge.
As compared to the problems with nose and throat, no?
Yes.
Right, okay. So what are the causes of this ear pain? Most common causes, ear pain, hear loss.
Okay, so oftentimes when the patient goes to our clinic complaining of ear pain, the common also causes that may lead to these problems are, example, earwax. It's also very common, which is if it is so hard, it can obstruct the ear.
Okay.
Yeah, exactly, the impacted cerumen. No? That's the term we commonly use in writing the diagnosis.
Okay.
So, impacted cerumen. So, if it is too hard and it's stuck and it's obstructing the canal, somehow, like because of its hardness and it's too tight inside the ear, it can cause pain. Another common causes...
by the way, Doc, excuse me, can that also cause hearing loss?
Yeah, so it can lead to hearing loss or not really like as a total hearing loss, but it's a decrease in the hearing.
Yes.
Yeah, and also the pain that I mentioned a while ago.
Okay. So, how do we remedy that? Okay, kung, for example, that one, the cause of the ear pain is just the impacted na cerumen, we call that, or earwax. How do we remedy that?
Since, by the way, earwax is commonly produced, or rather, it's produced by the ear, no?
Diba
It's
it's a
normal.
protection also, Doc?
Yeah,
Oo.
exactly, because it has a pH of around below 5 or below 4, which is acidic. No? So if it is an acidic thing, then it can also prevent infection. Because,
Okay.
example, fungus, they don't like to thrive on mga acidic environment.
Yes, that's true.
Yeah. So anyway, so the remedy for this is, or the solution is to remove really the earwax. But at times, it's so difficult if you remove the earwax on your own. We get to see a lot of patients going to our clinic, no? So when they come to the clinic, they would say that while cleaning, suddenly they experience hearing loss. As if like, of course, or the reason for this is that it could be that they accidentally push the earwax inside. All the more it's stuck and it becomes obstructed, and it gives no reason for the air to pass through, and therefore causes a hearing loss.
Okay. So again, the remedy for that, do we need surgery?
Okay. The remedy, by the way, is to remove the earwax. No? So when they visit our clinic, what we do, there are many ways to clean the ear. Be it suctioning, the common term they use is Doc, vacuum mo niya akong earwax. And it could also be through an irrigation. The irrigation is more of to irrigate it with water for the earwax to be removed. So the pressure of the water removes the earwax. It go back from the eardrum, and then it goes out to the ear.
So dapat these things, Doc, ba? Kaya sometimes when you see this people doing these procedures on their own, dapat, di ba, doctors ra gyud ang mo flush sa ilang ears and
Well, ideally we recommend the patient, no, when they have problems related to the ear, I would encourage them to go to the doctor because the right thing for this is the proper instrumentation.
Yes.
So instrumentation is really important. Of course, we have the instrument to visualize the ear canal, and the eardrum for us to evaluate properly. So when the ear is properly evaluated, of course, you can also do a proper management if there is a problem of the ear.
All right. Thank you, Doc. Now, other than these impacted na cerumen, what are the other causes of ear pains?
Another common causes of ear pain is ear infection. Now, this ear infection,
is that what we call otitis, or not necessarily?
yeah, otitis, which is, by the way, the ear has it's divided into a different, like,
Different
shall we
segments?
say, segments, no? So, like, you have the outer ear, the middle ear, and the inner ear. So, if there is an infection of the outer ear, we call it otitis externa.
Okay.
Now, if there is
Outer
an
ear.
infection of the middle ear, we call it otitis media. And then the internal part, or the
Otitis.
innermost, is the otitis interna. We usually encountered in the clinic this otitis externa and otitis media. So these are the common diseases of the ear.
Usually these otitises. Ito, joke lang daw.
Okay.
Kaning otitis ba, who are more susceptible sa kaning mga ear infection?
It's hard to say who are the most
More,
susceptible. It's more of like, well, for otitis media, it's common among the pediatric age group. But for otitis media,
You mean externa, otitis
yeah,
externa?
sorry, like otitis media, it's common in the pediatric age group. The otitis externa, it's common in the pediatric as well as in the adults.
Okay. What usually is the cause of these infections?
Well, when we say infection,
is it because of too much cleaning or?
So ingon ani, these are just factors, no? Example, because when we talk about what are the cause of infection, bacteria.
Yes.
So it's the bacteria.
Bitaw.
No wonder
Yes,
we give them antibiotics as treatment. But the common factor, one of the most common factor na it can lead to infection is we often encounter this in the clinic when we extract the history. There is a history of ear cleaning, no? So the use of whether be it cotton buds or a stick or a metal, no? So people even though when they are at the clinic, we tell them not to clean their ears, but they love cleaning their
it feels
ears.
Good.
Actually, yeah, they feel that's what they say. No?
But
they
your
feel
day without
comfortable.
is not complete if after you've taken a shower you don't clean your ears.
Yes. So we always advise them not to clean their ear using cotton buds or any object that they can
poke
inside because the ear itself has its own mechanism to clean. So it
How
can
does that
clean
work,
itself.
Doc?
So like have you ever wondered sometimes when we keep on moving or just by sitting down, we notice that some of our earwax fell,
Fall off.
or like magfall, sa shoulder, So case like that because it keeps on renewing, this the surface of the ear keeps on renewing and it is sending out these mga debris.
Chewing, Doc, I heard chewing is also one way of
Chewing kasi it helps the ear canal move, So once it moves, it also
pushes away the dirt.
Okay.
So, Doc, these ear infections, if we don't treat them, what could be the worst case scenario for these infections?
So we're talking
potential
about
complications.
Complications. So there are many possible complications if we don't treat the ear. Well, first and foremost, actually, so it's like this. The ear or ear problem, ear infections, most of which, like ear diseases, most of which are really preventable. So patient, when they go to the clinic, visit us in the clinic, and when you treat them, once they're okay, they're okay, but at times it will recur,
Yes,
the pain will recur, or rather the problem, the infection will recur. And once it's treated, again, you are considered healed, But the thing about the complication is when you don't do anything.
Okay.
That is why most of those patients who get ear complication is really there was like some sort of like in a way they neglect the infection. They just
they just let it be. They don't mind it.
But fortunately, so these patients lang, since the earring manggod, it's like related to hearing.
Yes.
So people get scared,
Yes.
When you lost your hearing. So actually, usually they go to the doctor, but sad to say, most of those people who have neglected their ear problems is patients who are in the, I would say, less fortunate because
see.
they're afraid to go to the clinic.
Yes, because expensive
because
right.
like the idea of this thing about being very expensive. No? But no, usually the advantage of going to the clinic and
having your ears
checked is you avoid the complication.
Yes.
So anyway, the complication, these are like permanent hearing loss.
Yes.
No? So then one of the worst complication, which is also life-threatening, is brain infection. So like a meningitis, no?
Right.
So these are
that's very dangerous.
the fearsome complication of neglecting, no, these mga simple ear problem. Initially started as a very not really that complicated problem.
No,
so
simple
now this complication sometimes, no, like brain abscess, patients need surgery already. So the more that you will spend
yes.
no.
So it's important actually that even if that's a very simple ear problem, you see your doctor right away to avoid further spending more money ba, no?
Exactly.
Yeah, okay. How do we treat these? Kanang mga common lang. For example, you mentioned earlier na kaning otitis media is common to pediatric doctors because kaning mga little ones, they keep on putting stuff inside their ear and sometimes
that's also another common problems that we see at the clinic. This foreign body, be it like a stone or a pellet or
my son
food.
had a mongo thing inside his ear.
So we also, of course, we remove this mga foreign body. But you mentioned about maybe you're referring about the otitis media, no? So how do we manage this thing,
how do we manage
or this disease, no? So by the way, usually for otitis media, we usually ask the mother or the patient if they have problems related to the nose, like cough or colds, no? Because these problems also would lead to
ear infection.
No?
That's right.
So, but infection is treated if it is bacteria, so we treat it with antibiotics. So, we usually give or prescribe antibiotics to the patient.
And usually we stop there. If it's just early, antibiotics can do the thing, right?
Because the ear, for otitis media, there is such a thing as the stage of resolution, meaning after giving the antibiotics, it will resolve.
Yes.
But if not, then there's also this stage of complication. So for the complications, these are, I mean, the one I mentioned a while ago, like brain abscess, meningitis,
scary ones
hearing
already.
loss.
So Doc, how do we properly take care of our ears? How do we prevent these infections?
I mentioned this a while ago that most of those who go to the clinic, no, and they have problems about ear pain, they have history of ear cleaning, no? And the ear cleaning, of course, they make use of the cotton buds and other
sometimes even sharp and hard objects.
Sharp objects, no? So now when you clean your ear, so we have to remember that, well, the ear itself, no, it has its own protection.
Protection.
Yeah, so the protection there, when you keep on at the surface, when you keep on cleaning, so you remove those mga protective mga mechanism of the ear. So when it is removed, no, you are more prone of developing an infection. Now, so my advice is that you stop cleaning your ear with mga devices or cotton buds, because again, I mentioned also that the ear in itself has its own mechanism to clean, no? And when you clean your ear, you really want to, this is what I tell to the patient, no? If you really want to clean your ear, and it's really hard to avoid cleaning the ear, then you just clean outside.
Yes.
Okay?
Yes.
Or one good thing is that tissue, perhaps, no? Or like the one, like this mga facial tissue, you just make use of them outside, no?
So creases lang outside,
yeah,
yes.
no need to poke
Push
inside,
inside.
and then the more, no, that you're
pushing actually, making the cerumen
the earwax, yeah, the cerumen. The earwax or the cerumen.
Sige, Doc. So would you suggest na they visit the clinic regularly, or do ear doctors, do they do ear cleaning also?
So we do ear cleaning.
Okay.
In fact,
Good.
I would say that that's the most common procedure we do in the clinic, no? So for the visit, what we usually tell, or what I usually tell my patients is that you come and visit me every 4 to 6 months.
Okay.
No, but there is really no hard and fast rule, because I encounter also patient that produces a lot of earwax that even 2 weeks it's already there. No, so they
depends on
come
the
back to
condition
the
of the person
clinic and
for-
then they say that, Doc, again I feel obstructed. So well, the solution there is to clean.
And you suggest, Doc, of course you recommend that it has to be done by health professionals. Like,
Yeah, I would encourage them to come to the clinic. Usually, one thing also that is, I would say, unique among our profession is it's more of instrumentation. So, of course,
do we
when you
mean with
have
that,
a lot
Doc?
of instruments, then you can perform more. No? So, like for the ear, when you clean your ear, you need also proper equipment.
Tools,
like you have your headlight and you have the different curette, no, to remove the earwax. We also have suction. No? It's more of like, they say, to vacuum the cerumen or the earwax.
I'm smiling because this is such an interesting topic. We're talking about earwaxes.
Yeah.
All right. Sige, Doc. Okay, so I think that's about it for the ears. No, we have to have our ears checked at least twice a year, have it cleaned by the professionals. We should avoid cleaning it on our own because we can actually create more problems.
Because all the more you push the whatever material inside the ear.
So let's now proceed to the nose, Doc, because you still cover that part of our body.
Yeah.
So the nose, what's the most common nose problem that you have encountered?
Yeah. Usually,
Or that you encounter?
patients come to the clinic because of, example, recurrent nasal discharge, okay, and or nasal discharge per se, no, and nasal congestion to nasal obstruction.
What are the causes of these? Nga nung recurrent man you mentioned, so why does
So
it
for
recur?
recurrent, oftentimes we meet patients whose problem is allergic rhinitis, which is very common, by the way. No, it's I would say like $1 billion industry because of the. So you see a lot of different medications for allergic rhinitis.
Doc, what's the difference between rhinitis and sinusitis?
Okay, rhinitis is inside the nose. The sinusitis is the sinuses.
Where are our sinuses? Kaninga part?
Yes, that part. But you have different, also 4 different types of sinus. No? So
how would you know if you have rhinitis lang or sinusitis? Which is worse, rhinitis or sinusitis?
usually the term is it's the term, no. But when we say rhinitis, no, so it's inside this triangle, no. So like the inside the nose, no. Now it's very hard to say which is severe, but usually in our guidelines, no, we usually, once you have sinusitis, usually patients have rhinitis. So it starts with a rhinitis, and it's not necessarily, I would say, like complicates, but
It progresses
yes,
into sinusitis?
to sinusitis. So usually when the patient have sinusitis, the term now is we make use of the rhinosinusitis. Okay.
Because it's the rhinitis that caused the sinusitis. Is that
yes.
in that case,
oftentimes, yeah.
in that. But are
It
there
started in the nose
rhinitis.
and then eventually to the different sinuses.
Are there sinusitis nga not rhinitis ang cause, Doc?
Are there, usually it starts with the
Rhinitis
right.
yun.
I can't remember of a sinusitis nga it did not start as a
rhinitis. Okay. How do we treat rhinitis? You mentioned that it's the most common. It's $1 billion industry.
But first of all, there are different type of rhinitis.
Sige.
So you have the allergic and the non-allergic rhinitis.
I thought allergic
very
lang yun
common
na.
ang allergic rhinitis. Now, for allergic rhinitis, usually the cause is, or there are factors, no, like the allergens. But there are different types of allergens, no, like dust, no, or pollens, no. So this can lead to, no, a reaction, and then allergic rhinitis.
Okay. How about katong non-allergic rhinitis, Doc? What are the factors for that
No,
or causes?
sometimes, no, the non-allergic rhinitis is like the one that is not allergy. That the one that is not allergens initiated.
Okay.
So like example, you smell something and then it's I don't know the common term for this because it's more of like autonomic, no, like it has triggered not the allergic part but the autonomic part. So it goes to the brain or the nervous system, and then that creates a cascades, and then it produces like an allergic type, no? So a congestion. So they have anatomical, like, which is like you have turbinates, no? So this turbinates is common. I mean, it's like it's the normal part of the nose, no? And then once it is enlarged, which is also it can be enlarged by the allergic rhinitis, so it creates congestion.
Okay.
So I would say the more common is the allergic.
No? How do we treat allergic rhinitis? Doc, na mga anti-allergies lang?
Allergic rhinitis is treated. No, like the management is very important. The management is to avoid.
By the way, is there a cure for allergic rhinitis?
There is no cure for allergic rhinitis. It can be controlled, yes.
You can manage
so
it, yes.
you avoid this mga nasal congestion, nasal discharge, but it can recur. No? So it will come back.
So how do we treat that?
So the management is to give like mga common mga medications that we encounter, no, in the clinic and in the pharmacy, the antihistamines, more common, no? So it can also be treated with intranasal corticosteroids.
Okay. Doc, sinusitis ba? Okay. Is there a treatment for that? Because I heard before from a friend na they had their sinuses cleared daw, murag wash. I don't know how it was done.
So when we talk about sinusitis, is the term used because there is an inflammation of the surface or of the lining of the sinus, no? Kumbaga, It's just like a kanang what we call this habol, no? Or the
Blanket?
surface, yeah. There's a blanket, no?
Uh-huh.
Sa the surface of the sinus, no? And the moment when it is inflamed, no, it thickens, no? And then that's the term, or that's the infection itself. It's caused by the infection. So there is an inflammation of the surface of the sinus, no? Now, your question again is,
Can we clear out?
Ah,
Because they say daw sinusitis,
sorry.
it
Yeah.
can be treated by clearing out the
Yeah.
mucus inside.
that's one of the management.
Okay.
It's more up to the irrigation, because during the irrigation, remember you have there at the surface mga different mga like allergens, bacteria. So when you do the irrigation, it can remove, no, these mga bacteria at the surface. So that's one management, no? That's one of the management.
Kanang irrigation you're talking about, Doc, that should be done in the clinic lang or in the hospital. It cannot be done at home.
Now, nowadays,
Sa sinuses, I'm
Yeah.
asking about the sinuses.
it can be done at home because there are many available nasal spray that you can just purchase at the
Pharmacies.
pharmacy.
Oo.
And also with instruction, and it's pretty safe. I mean, you
okay.
just have to squeeze the bottle, and then it will go inside the nose, and it washes out the surface, and then
Okay.
it goes back to the nose or at the back of the throat, no? So you can spit it out.
Okay, so no need to visit the clinic for irrigation.
That's for the irrigation of the nasal, no? But for sinus, lahi pod siya kay, I think what you're referring before, magod, we used to go to the doctor, and then there's this instrument wherein you can insert it at the nose and then make use of it as a form of irrigation. But at present, magod, the nose has its also own cycle. That means to say it can also clean itself, no? So and that's the reason why we seldom do this in the clinic. And then plus the availability also of the what do you call this, the over the counter mga sprays.
Okay. So how would you what would you suggest to our viewers? How should we properly clean our nose? For example, we have kana gi-atake tag rhinitis, and then congested gid kaayo. What would be the best home remedy for that?
So during COVID times, we are told not to keep on holding our nose, no, or cleaning it
Yes,
using
yes.
our fingers or the digits, no. We try to avoid this because, of course, to stop introducing bacteria, no, or viruses inside the nose, no. Another thing is that if you really want to clean your nose, as I mentioned, you have the different sprays available.
Kana lang.
It's a sodium chloride. It contains sodium chloride, no? And these are equivalent to the waters, no, that we have in nature, no. So sa sa dagat, no, sa sea, no. So these are, of course, cleaned and sterile, no. So then we can make use of that to clean the nose. But never to keep on introducing
foreign objects
yeah.
lagi na in our nose. So it's the same thing because other people also use kanang cotton buds also to clean. We should avoid that also.
It's also common to remove the hairs, no, of the nose. We call it vibrissae, no, the medical term. No, but the hairs of the nose, no, it helps also protect us from mga infection, no? It helps filter mga dirt or dust, no? Now, when you remove this, of course, no, you try to inhibit their function, no? So And there are even mga cases wherein you have to pull it out, no? So remember, when you pull out the hairs, no, of course, no, there's a pore, no, an opening.
Yes.
So then this can be prone to developing an infection.
All right. So probably what we can do is we can just trim, especially for the men bitaw. Usually they're the ones with kanang mag-bushy na ba inside. So maybe we can trim, but we should avoid pulling it out because again, it can cause infection eventually.
Yes.
Again, this has been a very interesting topic, Doc, no? What would you want to say to our viewers as a parting message, how to take care of our nose or ears?
Yeah. For the ear, of course, no, you don't go to a doctor if you don't have any problem, no? I'd like to encourage everyone, no, although it's kind of hard, no? And that's the reason why I keep on telling my patient not to keep on cleaning it with your ear, no? To clean using cotton buds, no? To clean of like any object, no? Because now, in my practice, I have seen more patients in the clinic, no? Where when they come to the clinic, they have problems. It's because they keep on cleaning it.
Yes.
So, like I mentioned a while ago, because when you clean it on your own, you cannot see, no? So, you might accidentally push the earwax. You might remove, no, those mga important mechanism or protection, no, of the ear, no? So then you're more prone to developing an infection. So when you clean your ear, then yes, you can, if it is really hard to avoid, then you just clean it outside, okay? So that to ensure na you cannot touch what is inside. Now, for the nose, like I mentioned a while ago, of course, no, not to keep on touching the nose, no, with different objects, no. Our nose also can clean, no, on itself, no. So like it keeps on cleaning it, no, cleaning backwards, and it's either we can swallow it or we can spit it out, no? So when you put something, no, like the spray, when you spray, you will know that it's going backwards or at the back portion of the nose because we taste it, no? Somehow it's like salty, no? And then that's the function, that's already an evidence that the nose, no, is functioning properly, no? Because it's like brushing, no, or it's like a broom, no, that is the direction is going backward. So let us not keep on touching the nose.
Let nature do its job, right?
Yeah, that's the term. Yeah, that's the term I'm looking for, no? So let nature do the job, no? So that's for the ear and for the nose.
Doc, we have learned so much from you today, and we hope to see you again on the show.
Thank you very much.
Thank you very much,
Yeah.
Dr. Jamon Cabaneras.
Yes. Hope to see you again.
Yes. Thank you, Doc. And that's it for the third episode of Maayong Adlaw, Doc Season 4. Thank you very much for watching, and please share this video to your friends and family so they may also learn from our discussions today. And from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience here in Cebu at the Hospital at Maayo. If you want to learn more about the Hospital at Maayo, please visit their Facebook page or their website at www.thehospitalatmaayo.com or check out them in these numbers below. All right. So I'm Priya Padilla from CDN Digital, and see you again next time.